everyone. So this is Dr. Ellie, and welcome to the podcast. It's called I Heal Kids because that's what I do. I heal kids. And I'm a board certified pediatrician for those of you that don't know me yet. And I have a passion for holistic, integrative, and functional medicine. I founded Middle Path Integrative Pediatrics because honestly, I just believe that there is a better way to care for kids. And I do some adult work as well. So if you need that, let me know. And an approach that focuses on wellness rather than just treating illness as it arises. So my approach is all about looking at the whole child, body, mind, emotions, environment, because honestly, it is all connected. So at Middle Path Integrative Peds, I offer a unique model that blends conventional medicine with natural approaches and functional medicines, deep dive investigations as well. And so because my goal is to help children thrive and not just kind of get by, in this episode, I really just want to share more about why I practice this way, the benefits of holistic and functional medicine, and also just some success stories to kind of highlight and explain how transformative this approach can be. So let's dive right into the benefits of holistic and functional medicine. So like I said, my approach is wellness-based, wellness first versus illness first approach. And it's all about whole person care. So instead of looking at just like symptoms, I'm going to consider things like nutrition, sleep, stress, lifestyle. For example, a tummy ache, it's not just about giving your kiddo like an antacid or something like that. It's asking like, why is this even happening in the first place? So why do they have the tummy ache? So my preventative approach is all about, it's like waiting for, instead of waiting for kiddos to get sick, it's all about, trying to keep them healthy. And how do I do that? So this means, supporting the immune system, supporting gut health, and optimizing well-being before problems arise. So for example, making sure that we have stress reduction techniques in place prior to a child developing anxiety. So it's kind of a fun way to look at things because we're actually preventing problems before they come about. The other thing that I do in my practice is I focus a lot on really like personalized medicine. So, every kid is unique and what works for one kiddo may not work for another. And that's why I don't give any like one size fits all approaches because that doesn't really work. So for example, if we're talking about food, there may be one child that's very willing to eat a variety of foods and another child that is a little bit more picky or even on the extremely picky spectrum. And so those are very different circumstances where one child may need one thing, for example, just to focus on, whole foods, whereas another child who has extremely picky eating, may need actual feeding therapy before we can dive into diversity of different types of foods. So that's kind of why I need to make sure that the care is really personalized. The other thing that I do is we're healing from the inside out, right? So instead of like quick fixes, I'm aiming for sort of longer term solutions. So, whether it's like anxiety, ADHD, asthma, chronic infection, I really want to empower parents because one of the most important aspects of my practice is really giving parents the knowledge and tools that they need to feel confident in supporting their child's health at home so that you don't even have to come in necessarily once you know what to do already. So what are some of the integrative therapies that I use? Well, one of them is osteopathic manipulative medicine or osteopathic manipulative treatment. You may hear it both ways, OMM or OMT. And that is a type of body work where we do really gentle muscle releases, fascia releases, things like that to help release restrictions in the body and promote healing. So that's one type of thing that is a little bit different when you see me. You may notice I'm doing some body work on your newborn that you wouldn't necessarily see in a conventional practice being done. The other thing is herbal medicine and homeopathy. These are, I try to incorporate these safe natural therapies that can work alongside conventional medicine, to create a truly integrative approach. So I'm not necessarily never using conventional medicine. So for example, if your kiddo breaks their arm and they need a cast, or they have appendicitis and now they need like an emergency surgery, or they were in a car accident, we need blood transfusion or something like that. Those are the times I think that Conventional medicine's really good. It's really good for those kind of emergency situations, the situations where we need acute care, quick fixes, all of that. It doesn't work as well in the times that we're trying to kind of prevent or correct like a long-term sort of fundamental physiological issue. So for example, if your kiddo has been having anxiety for a long period of time, it could be that they have a genetic predisposition to having low serotonin levels. So hormone levels that keep us calm, hormone levels in the brain that keep us kind of calm and happy and relaxed. And, if you never tested those levels, you would not know that. And then you wouldn't know that, what they need is an amino acid called tryptophan. And I can just give that to them and they're going to feel a whole heck of a lot better, usually with a lot of other things too. But that's just kind of like one simple example of kind of how functional medicine works. Integrative medicine is sort of an umbrella term. It includes, all the different things that we're using. So herbs, mind, body, exercise, food as medicine, regular medicine, conventional medicine, and functional medicine. So all the things combined. I think where it gets a little bit tricky is that integrative medicine has been conflated with the word functional medicine a lot, and that's where people are often confused. So functional medicine is very specific. So it's actually focusing on the interaction of your genes, like your DNA, your genetic code, with the environment, with the lifestyle factors. And because of that interaction, it's kind of interesting. It can really affect your health. So it used to be back in the day, in olden times, that we thought your DNA is what it is. You're born with your genetics. And if you have a gene for something, you're going to get the illness. And if you don't have the gene, you're not going to get the illness, something like that. Turns out that is not really how the body works. The body is a lot more complicated than that. And our genes actually interact with the environment around us. So, they interact with like the foods that we eat, they interact with the toxins in the soil, in the air, they interact with the supplements that we take, they interact with the exercise that we're doing. And all of these things affect our DNA, and our DNA then affects how we build protein. And protein is one of the main building blocks in our body, along with many other things that can affect how well our bodies function. So this is why it's called functional medicine. So we're looking at how well are our bodies functioning. So it's not as good, in my opinion, at treating things like broken arms or acute injuries because it's not really a functional issue. That's more of like a structural issue. And so that would be something that may be better addressed with a different modality, like, for example, a cast or chiropractic or OMT or physical therapy, just sort of depending on what's going on. But functional medicine is really great at looking at how our body systems interact and how the biochemical markers in our bodies work. So another example would be, let's say you're an adult who's extremely burned out. You've been working, 100-hour weeks for 3 years, like in my residency, and, you're not eating that well because you're trying to grab food really fast. And now your body is just giving out on you. This is like a perfect situation for functional medicine because your body's not necessarily kind of completely broken like a broken arm, but it's just sort of offline. It's just not like working as well as it should be. And that's where we can go in with functional testing to assess, like, what are your nutrient deficiencies? What are the toxins that are affecting you? What, antioxidants do you specifically need? How well are you detoxing and all of that? And then we can go in and create like a personalized health plan for your child to determine what dietary supplements, which dietary supplements is simply another word for like things that we're giving in addition to food to help the body run better or function better. And I'll give some more examples later, but that's kind of the difference between functional and integrative. Integrative is more of like an umbrella term, and functional is more how is the body functioning. I think the other thing that functional medicine is really good at is like if you want to optimize your health, let's say you want to, stay healthy, live longer, address underlying issues that you might not even be aware of. That's a great place for functional medicine as well. So just doing some testing to see, do you have any issues that could, that your body could benefit from some additional nutrients so that you can run your body better and function better. Okay. It's also helpful for digestive issues. I'm not sure if I mentioned that. Mental well-being, hormone imbalance, long COVID. We talked about burnout and fatigue. Or if you just want to like increase performance at school, sports, or work, and basically live a healthier life, then that's where functional medicine, in my opinion, really shines. Why do I focus on wellness-based care? Okay, so let's back up to Dr. Ellie when she first graduated with her very conventional medical degree and joined a very conventional medical practice. And by the way, there's nothing wrong with these practices. It's just a different way of being and a different system that may not be optimal for everybody's situation. Okay. So I was working in this medical practice that shall go unnamed with really great doctors, and they were working really well to, try to optimize kids' health as best they could. However, the system that they were in was one that was insurance based. And if you don't know, insurance-based medicine is pretty challenging for both doctors and patients. I think a lot of people don't really think about that, but the reason that that's the case is that insurance will allow or not allow that physician to do certain things, meaning they won't reimburse the physician or the practice for the visit, the money that they need to be paid to keep their businesses running, unless they stick with inside this box that the insurance companies believe to be the correct pathway for the patients. So, simple example, I was taking care of a newborn. I think they were newborn. They might have been a little older, 2 or 3 months. Can't quite remember. It's like 15 years ago. And this was at a time where I was still prescribing omeprazole, which is like a acid suppressor for reflux. Not something that I do anymore now that I have, unless we're in a dire circumstance, now that I have more training. But at the time, that's kind of where I was in my training based on what I had learned in medical school. And I prescribed a liquid because it's a baby. You need to prescribe a liquid so they can take that. And I got a call from the insurance company. And they were like, well, we're not going to fill that. And I was like, I don't really know why. Can you tell me more? And they said, you need to prescribe a tablet. I'm all, well, this is a baby. I'm not quite sure how we're going to get that tablet into the baby. So I think we should probably do the liquid. I was on the phone, you guys, for literally an hour and a half. I could not get this person's medication approved. It was like talking to a brick wall. I mean, I can't even say how frustrated I was and the family was, because according to the insurance company's algorithm, I was supposed to be prescribing a pill. And this is just like the tip of the iceberg, right? So that's one aspect, is that, physicians are kind of stuck with these algorithmic treatment methods. And the other part is, because the reimbursements are so low by the insurance companies, in order to keep their businesses running, you guys, they have to see a large number of patients. Okay. So my patient panel, I think at the time, was between 1,600 and 2,000. Don't quote me because it's been a long time. But I was seeing a patient every 15 minutes, right? And that's fairly normal for most insurance-based practices. There may be a little bit of flexibility there, like 15 to 20 minutes or something like that. But most of the time, you have to get people in and out the door, patients in and out the door. Why? Because you need to get paid by the insurance company so you can keep your business running. So, for the sake of efficiency, what happens is medical practices will hire a lot of staff to help because they need the help. So, you'll go in, and what happens? So, you walk through the door and you check in at the front desk, which is, what it is. That's fine. And then you sit down and you wait for a long time sometimes. And after that, then you go see usually a medical assistant who will do what? Like your vitals and your weight and your blood pressure, whatever it may be. And then they put you in that little tiny room, and then you sit and you wait more. And then what happens is the poor physician who's working in this structure is running from room to room, trying to see all of these patients so that they can get paid and that their medical practice can keep going. And they rush in, and they've got about 5 to 7 minutes to see you. And why is that? Because there was a 15-minute appointment. 5 minutes of that time was spent with a medical assistant. And then they do need to get that chart finished where they type at the end of the day, get it sent off to the insurance company so that they can get paid. So if they're not getting that chart work done, they're doing it after hours, which is lovingly known to physicians as pajama time, which means that we're left charting late at night. So that's one reason, is just the structure of care is not where I want to be. It's kind of getting people in and out the door and adhering to these very prescribed ways of treating people. The other thing too is that because of this system, if you're doing anything outside the box, it's really difficult for the insurance company to even want to reimburse it all. And so that doesn't work. Another reason too is if I wanted to focus on wellness, I'll give you an example. If I want to talk to a new mom about breastfeeding for half an hour, I get paid nothing for that in this insurance-based world. And as we know, breastfeeding is one of the most important things we can do for our children. Of course, I understand there are times that we absolutely cannot breastfeed. Milk does not come in. We have a medical condition, what have you. That's not what I'm saying. But in general, a lot of people do want to try to breastfeed. And if I'm talking to someone about that in this insurance model, I don't get paid. And that's because the insurance model does not recognize that me talking about breastfeeding is preventing a lot of illness, right? Because you don't get paid for prevention. On the other hand, if I take out a splinter, I get paid by the insurance company, at least the last time I checked, it's been a while, y'all, $685 a splinter. And I know that from personal experience because a patient who saw me in one of these insurance-based models actually had to reach out to me because that's what they were charged. Okay, so lots of reasons that I don't want to base my practice on a illness-based model versus a wellness-based model. And lastly, and maybe should have been first, wellness, who doesn't want their kid to actually stay as well as possible versus, being sick all the time and just having your doctor put out fires as they come up.
We'll be right back after this message from Dr. Ellie.
The moment you welcome your baby into the world comes with many decisions. Do you want to give eye ointment, delay the first bath, choose newborn screenings, or do a circumcision? The truth is, many parents arrive at the hospital or birth center unprepared to make these choices. And beyond birth, there are key decisions about reducing toxins from the environment, improving nutrition, and supporting your baby holistically. If you don't know me, I'm Dr. Ellie, a holistic pediatrician at Middle Path Integrative Pediatrics in Asheville, North Carolina. And this free webinar empowers you with knowledge before the rush of labor and delivery. You'll walk away feeling confident and ready to make the choices that align with your values. If you want to nurture your body during pregnancy for a healthy start, feel confident about making informed choices about newborn care, learn holistic approaches to support your baby's health, then this webinar is for you. So join us to feel empowered, prepared, and supported as you welcome your new baby. Click below to reserve your spot. Wishing you well. I guess the other thing to talk about is in conventional medicine, the approach is very much the diagnosis and the treatment. So it's what do you have? Okay. So for example, let's go back to this gut health issue. Let's say a kid has constipation. Okay. You come in, your kid's been, hasn't pooped for 3 to 5 days. You see your doctor, they're like, you have constipation. Great. And here is your medicine, Miralax. Okay. Done. But what if your kiddo doesn't get better and they remain constipated for months and now they're on Miralax for months and months? Well, maybe we should have flipped that and figured out how to keep their bowels regular in the first place. And now that this is happening, how to address it with supplements, food as medicine, and some more natural treatments so that you're not on this medication for years and years. Okay. Now, that being said, it might take a little bit of time to unravel all of this stuff, but usually we can get there. So I really want to make sure that we flip this kind of model of diagnosing and treating illness and focusing on helping kids so they can thrive and they don't end up in a this recurring cycle of sickness. So that's why I'm using Buddhist medicine, natural therapies, osteopathic techniques, and a deep dive into each of the kids' unique needs, just so I can support their healthiest life possible. So I guess to me, to sum it up, a wellness-based approach means we're not just putting out fires, we're actually preventing them from starting in the first place. And it means understanding how gut health affects immunity, how sleep impacts behavior, how nutrition plays a critical role in mental and physical well-being, and more. So not that your kid would never ever get sick, but as much as possible trying to stay on top of all of that. So I wanted to share a few little kind of success stories, I think, because an example just kind of helps, I don't know, for me anyway, it helps me kind of understand why something might be different or better in my opinion. So I've had the privilege of working with many families who've seen incredible transformations. And so I'll give you some of their stories. I've changed the names, obviously, for privacy purposes, so these names are not real. One example is a teenager named Lily. Lily had struggled with anxiety for literally years. Her parents had tried seeing therapists. They had tried working with a school counselor, getting an IEP, adjusting her nutrition. Nothing worked, And so they came to see me. We did dig deeper. We looked at her gut health. We looked at the hormones in her brain, the neurotransmitters that are responsible for happy, calm feelings, and also her detox pathways. And, through the dietary changes, the dietary supplements, the targeted supplements, stress management techniques, and helping her detox pathways work better, she was finally able to relax and actually handle school better, as well as social situations with a lot more emotional regulation. So, for the first time in literally years, she was finally comfortable in her mind and body. Another family came to see me with their young daughter who had literally had diarrhea since birth. And her parents were constantly told, nothing to do. They had been sent to a gastroenterologist. The gastroenterologist was like, nothing to do. It's fine. Don't worry about the diarrhea. The pediatrician had tried some probiotics, didn't seem to do anything. So what did I do? I ended up doing a GI map, which is a gut test looking for different pathogens like bacteria, parasite, and viruses. And it turned out, you guys, that she had actually been living with a parasite this entire time. And so, literally within months of treating her with supplements and food as medicine, we were able to get that parasite cleared. And then she now no longer has diarrhea every single day and is having kind of pasty poops every 2 to 3 days. Another good example is an adult called Jim. Jim was struggling. He had fatigue and burnout. He was a high executive kind of guy and has career. He was working at a big company, had a lot of responsibilities. He was suffering with reduced performance at work, which was really hard because he did have this high level job and he was just so burned out and exhausted and really couldn't get on top of it, even though he was really, he was a really motivated kind of guy. And conventional medicine had offered him medications like antidepressants, but he really didn't feel like it was truly depression in that way. And he didn't really want to do conventional antidepressants. So we did end up doing some adrenal tests looking for adrenal fatigue, looking at his nutrition and also his stress resilience strategies. And we definitely identified a bunch of nutritional deficiencies, which is no surprise, when you have a busy job and it's hard to put in place some of those things, right? Because you're grabbing and then you run to the next thing and all of that. And then we, adjusted his lifestyle, did some supplements. And honestly, within months, he was energized, sleeping through the night, managing his home life better. His wife was like, I don't know what you did, but he's not cranky when he comes home anymore. So, I think the best thing for him though was he was just able to live a more sustainable and productive life where he felt like he could manage these responsibilities. So these are kind of the stories that are, what I do, and really seeing children, adults, families heal and thrive is that's what fuels my passion for holistic pediatric care. That's a little peek into my approach in pediatric care. I hope it has given you insight into, what is holistic and functional medicine and how it could truly make a difference in children's lives. And I just really believe that every child deserves to feel their best and every parent deserves the knowledge and support to help them get there. So, thank you for joining me today. I love having these conversations with you. If you found this episode to be helpful, if you can think of even one friend that you know of that's like, let's say they're having a baby, they're pregnant, they need a pediatrician, or they have a kiddo that's experiencing some chronic health issues, or it's an adult that needs help with burnout or exhaustion or something like that. If you can think of that person in your life, please share this episode with them, because my goal is to serve 200 people in the next 2 years. I'm putting it out loud finally, so that I can help people be healthy, because that is my passion and my goal. So if you can share it with them so they can get the help and support they need, I would appreciate it. And I hope they will appreciate it too. Also, a 5-star review would be very helpful. Thank you very much if you can do that. And stay tuned, because the next episode, I think, is going to be something pretty special. That's all I'll say about it. Again, I'm Dr. Ellie McGregor. My practice is Middle Path Integrative Pediatrics in Asheville, North Carolina. If you are living in or around Asheville, North Carolina, and you need a pediatrician or you need a functional medicine doctor, please reach out. If you are living in North Carolina, South Carolina, California, or Florida, I can also do functional medicine for you. I just can't be your primary care doctor unless you're coming once a year, but not adults, because I'm a pediatrician. Okay, guys, wishing you well. I'll see you next time. I hope that was helpful. Bye.